Muy buenos días desde Washington, D.C., sede de la Organización
Good morning
Panamericana.
from Washington, D.C., HQ of PAHO. My name is Maria Amparo Lasso, Director of Communication for PAHO, and I am extremely happy to welcome you to this joint press conference with ECLAC and the Economic Commission for Latin America and the Caribbean to present the publication that is titled The Prolongation of the Health Crisis and Its Impact in Health, the Economy, and Social Development. So this is the second joint publication in the context of the COVID-19 pandemic, and it's product of a fruitful collaboration that has been very long between both institutions that, of course, gains even more importance today within the context of the pandemic. So the complementary work between ECLAC and PAHO allows a comprehensive approach that includes the areas of technical cooperation of both agencies. So the report that we're presenting today updates the evolution of the pandemic and its implications in health, and also social and economic implications, and it also defines potential scenarios about the control of the pandemic in the short term, and analyzes the action lines in the long term that have been recommended to strengthen our response capacity from all our states. So the Dr. Carissa Etienne will present this report today, Director of PAHO, and Mrs. Alicia Bárcena, Executive Secretary from ECLAC. So we have Mario Cimoli, who is the Joint Executive Secretary from ECLAC, also Antonio, who is also part of the Social Development Department of ECLAC, James Fitzgerald, who is the Director of the Department of Systems from PAHO, and Savannah Aldigueri. He is a Joint Director for Health Emergencies for PAHO for COVID-19. So welcome to all of you. So we will open this session with presentations that will last about 20 minutes from each one of the panelists, and then we will open to the Q&A session with the journalists. So we thank all the representatives of the press of the media that are here with us today. We will be accepting your questions through email and through the Q&A button in this platform. Without further ado, I will give the floor to Dr. Carissa Etienne, PAHO's director. Go ahead, Dr. Etienne.
So good morning, and a warm welcome to the media and others who have joined us for the launch of this important report. I'd like to recognize Ms. Alicia Bárcena, the Executive Secretary of ECLAC, and the staff of ECLAC, the PAHO Executive Management, and PAHO staff and guests. PAHO is happy to have collaborated with ECLAC last year and again this year in joint reports that highlight the linkages between health and the economy to control the COVID-19 pandemic and retake the path towards the Sustainable Development Goals. The Pan American Health Organization is an international organization dedicated to protecting and advancing public health in the Americas. Founded in 1902, it is the world's oldest international public health agency. At 119 years, during its century-plus existence, PAHO has catalyzed Pan-American cooperation that has contributed to such major regional health achievements, among them a gain of 30 years in average life expectancy since 1902, the eradication of smallpox and polio from the Americas, the elimination of endemic transmission of measles and rubella. We have also seen major reductions in infant mortality. PAHO has worked with member states to surge response capacity during public health emergencies, of which we've had many, and has invested in institutional capacities that have contributed tremendously to confront this unprecedented COVID-19 pandemic. The region of the Americas has been the epicenter of this pandemic. As of October 13, 2021, the Americas reported more than 91.7 million cases, which some 39% of global cases, and more than 2.3 million deaths, 46.3% of global deaths. 5 countries of the Americas, USA, Brazil, Mexico, Peru, and Colombia, are within the top 10 countries in the world with the highest number of cumulative deaths. However, every country in the region has been affected. We have seen also significant death rates in healthcare workers related to the lack of available protective equipment. Although all age groups have been affected in terms of cases, this graphic shows on the left side that case rates are similar between men and women, more concentrated in the 25 to 39 age group. However, in terms of mortality, the graphic shows on the right side that men have been more susceptible than women, and that the largest number of deaths occur in the 65 to 74-year age bracket. Socioeconomically disadvantaged population groups are at greater risk of infection and death from COVID-19, and this has been reported. Similarly, there is a correlation between excess mortality and the proportion of the population living in overcrowded conditions, such that the areas with the highest rate of overcrowding are those most affected by the COVID-19 pandemic. Data for 18 countries and territories of Latin America and the Caribbean on excess mortality from all causes reported that in the biennium 2020-2021, as compared to 2015-2019, show that the countries with the worst relative position in terms of the Sustainable Development Index, which includes measures of income, education, and water and sanitation, that they suffered higher levels of excess mortality from all causes in 2020. When we look at some of the, and we can go through this later, but some of the indices that go towards the Sustainable Development Index, we see that this includes 3 well-known and robust proxy index: the GDP, the SDG targets that related to that, the years of schooling, and looks at social dimension, and it's also the access and of coverage, at least basic access and coverage to sanitation services. And that has been established, the SDI index has been established by PAHO to be used as a standard equity stratifier for the analytic exploration of SDG 3 related health inequalities, as well as to create accountability on the promise to leaving no one behind in the 2030 Agenda for Sustainable Development. Pre-pandemic, millions lacked access to quality comprehensive healthcare in our region, and many countries reported important access barriers, including the high burden of out-of-pocket expenditures. We therefore have seen a higher impact of the pandemic in our region as a direct consequence of these vulnerabilities. National levels of personal healthcare access and quality can be approximated by measuring the mortality rates from causes that should not be fatal in the presence of effective medical care. And we refer to this as amenable mortality. An estimated 1.7 million deaths could have been avoided in 2016 if there were accessible and quality services, leading to 1.3 million deaths in Latin America and the Caribbean. In terms of access barriers to appropriate care, about 2/3 of the population in the region, 29.3%, did not access the needed care that due to different types of access barriers. That means in real terms that about 279 million people had unmet needs for healthcare. In most countries, the percentage of people who report having foregone needed care is higher among individuals in the poorest wealth quintile than the richest 20%. The absolute wealth gap is 7.8% between the poorest 20% and the richest 20% of the population foregoing care. Of those who report foregoing appropriate care, 40.6% attribute their decision to institutional barriers, financial accommodation, availability, and geographic barriers. Personal and cultural reasons as well, their beliefs, languages, preferences, perception of their health, knowledge of health is cited in some 57.9% of cases. Notwithstanding the UHC Service Coverage Index, that's measuring progress in SDG indicator 3.8.1, this increased from a regional average of 77% in 2015 to 79% in 2017. And I may add that this was the highest increase of all WHO regions in the world. The gains in service coverage have, however, come at a major cost to individuals and their families. The incidence of catastrophic health expenditure, defined as large out-of-pocket spending in relation to household consumption or income, increased continuously between 2000 and 2015. The proportion of the population with out-of-pocket spending exceeding 10% of their household budget was 11.3% in 2015. And the proportion with out-of-pocket spending that exceeded 25% was 1.8%. So when we look at it, about 109.8 million people spent more than 10% of their household income on healthcare in 2015, and about 18 million spent more than 25%. Based on a relative poverty line defined as 60% of median daily per capita consumption or income, the percentage of the population impoverished by out-of-pocket health spending increased from 2.2% in 2015, and that is 14.6 million people. So those inequities existed well prior to the pandemic. The long-standing systemic deficiencies in our health systems and the inadequate priority that we have afforded health over the years has prolonged this health crisis due to COVID-19. The low levels of public expenditure reflected in unavailability of critical resources, human resources, infrastructure, supplies, and underfunded essential public health functions. Most of the countries in our region are well below the 6% benchmark of public expenditure in health as expressed as a percentage of GDP, and well below the OECD average in absolute terms. Fragmentation and segmentation, low resolution capacity of health networks, particularly at the first level of care, and the relative scarcity of human resources. So we do have like 20 physicians per 10,000 population on average, as compared with 35 per 10,000 in the OECD countries. All of those are expressions of lack of political priority for health and are key determinants of the impact of this pandemic in the Americas. Given scarce resources, countries were forced to respond to clinical demands from moderate to severe diseases. A great deal of the response focused on increasing hospital capacity, especially for intensive care. Data from 16 countries shows an increase of 61,100 ICU beds from March 2020 to September 2021. And this is a 99% increased capacity. However, in many countries, these ICU beds represent a reconversion of hospital beds that were already available before the pandemic. And also, We must note that qualified human resources cannot be increased as fast as we would like. And important to note that hospital beds are only useful if qualified health professionals are available to provide the necessary care. As a result of pre-pandemic vulnerabilities, plus having to prioritize hospital care at some point of the pandemic, essential health services were interrupted in almost all of our countries. Clear evidence of interruption of essential health services. 35% of countries on average, these interruptions disproportionately affected services that were provided at the first level of care, what people refer to as at the primary care level, with consequences on equity and the implementation of primary health care. For instance, routine immunization services have been disrupted and coverage levels decline, which of itself creates a potential for a public health threat and a crisis. The impact on essential health services is especially important during a pandemic. This being the first point of contact, the area to track, trace, and isolate cases, and now for vaccination implementation. More than half of countries reported disruptive services for mental, neurological, and substance use disorders, some 60%, and immunization, some 55% of countries. Other essential health services for reproductive health, maternal, newborn, child, and adolescent health and nutrition, neglected tropical diseases, non-communicable diseases, and communicable diseases was disrupted in more than 40% of countries. That means the majority of people in our region did not have access to the basic essential health services that they require for continued health and well-being. We have witnessed tremendous technological innovation in the development of COVID-19 vaccines. However, we continue to see terrible disparities in COVID-19 vaccination coverage between countries, and explained mainly by income level. The main challenges countries faced up till now was the non-availability of vaccine doses and inequity in the access to vaccines. PAHO is already procuring vaccines in a pooled manner for member states beyond the COVAX mechanism, utilizing the revolving fund. And of course, you know that the revolving fund has 40 years of experience and response capacity, working with countries to help them calculate their demand and in ensuring that we access those vaccines that they require and help them in terms of implementing their vaccine plans. The course of the COVID-19 pandemic in the Americas remains highly uncertain. And we need to make that point over again. A prospective analysis considering possible scenarios in the short term, 6 to 9 months, can facilitate the understanding on what are the critical areas to be tackled to control the pandemic. In addition, given the possibility of infection with SARS-CoV-2 and virus transmission, even when vaccinated, and in the context of evolving variants, the short-term objective remains the reduction of hospitalizations and deaths. The possible scenarios presented in this section are a schematic representation of the situation across countries in the region. There are 2 actionable factors that have been chosen to better define future scenarios. One is the implementation of public health and social measures, and 2, the vaccination coverage dynamics. The COVID-19 pandemic and the analysis of determinants impacting traditional vaccination coverage rates have highlighted the need to assess vaccination coverage dynamics. It is important to bear in mind that both the performance of public health and social measures and the vaccination coverage dynamics are dependent on, but not limited to, several conditions, including virological and epidemiological context, equitable, timely, and affordable access to COVID-19 vaccines and related supplies, the capacity for effective implementation of national immunization programs, and structural conditions in terms of socioeconomic, political, and finally, the sociocultural and behavioral aspect. And these conditions are further described below. Following the main two actionable factors mentioned above, 3 generalized epidemiological scenarios for COVID-19 can be envisaged in the short term. So let's go to graph 1, which is scenario A. And remember, this is for the short term, 6 to 9 months. In this situation where there is low implementation of public health and social measures, at the same time as there is a low vaccination coverage, it is expected that high rates of community transmission will continue, generating sustained rates of hospitalization and deaths. Scenario B. This scenario depicts an epidemiological situation in which there could be a fluctuation of case incidence based on the 2 mentioned actionable factors. We've discussed this under B1 and B2. Let's look at scenario B1. Maintaining adequate levels of public health and social measures over time has proven to be difficult in many countries. The interaction with low vaccination levels would generate periodical increases in cases, followed by hospitalization and deaths. Scenario B2. Certain countries may not be able to achieve homogeneous high levels of effective vaccine coverage over time. If coupled with low public health and social measures, it is likely that spikes of cases will arise periodically. Countries in these 2 scenarios are likely to fall back periodically to scenario A, fluctuating back and forth depending on its situation. In scenario C, which is the last scenario, and it's the optimal one, where consistent and adequate implementation of the public health and social measures, together with increased and effective vaccination coverage, would lead to a situation in which hospitalization and deaths are reduced over time. Because of all of those uncertainties, PAHO at this time cannot predict that this pandemic will come to an end in 2022 or even 2023. All of this depends on the vaccination coverage that we are able to attain and maintain across the communities, which is our access to vaccines, but also the adherence to public health and social measures. To ensure high and equitable coverage of vaccines, we need to mitigate vaccine hesitancy and increase vaccines acceptability by accurate information campaigns and communications. Vaccination plans should be universal and sensitive to inequalities and access barriers that are within countries. And this needs to be done in a short term. We need to improve availability of products by strengthening the supply chains and regional coordination, the pooling of demands. Comprehensive planning for delivery, including financing and logistics, is going to be important, and increase regional technological capacities. We need to develop training programs for professionals for innovation in health, to create or strengthen the health research institutes, and strengthen the regulatory capacities. Of course, we need to transform health service systems based on primary health care. The universal health strategy, financial sustainability, and the role of the state are going to be important. Increase public expenditure in health and investments in public health interventions are absolutely critical. Increase investments in the first or the primary level of care, and we need to aim for at least 30% of public expenditure in health. The strengthening stewardship and governance through essential public health functions, and increase investments to develop capacities to implement those essential public health functions, including those related to the international health regulation compliance and disaster risk reduction and management. We need to maintain an intersectoral focus towards health policy. Preparedness to implement emergency social protection and income security programs as a requirement for alleviating the depth, breadth, and duration of public health crises. We need to strengthen social, environmental, and economic protection that is related to health. We need absolutely to reduce inequities and accelerate recovery of health gains. We need intersectoral pandemic preparedness and response planning to ensure that populations remain protected in the event of future public health emergencies. And we need to accelerate digital transformation of the health sector. Promoting solidarity between countries with regards to vaccine procurement and other health technologies is absolutely necessary. At the national level, we need to stimulate dialogue between health, finance, international relations, industry, but also civil society and communities. It will be important to articulate and harmonize technical cooperation between international, regional, and national actors like PAHO, WHO, World Bank, IDB, ECLAC, health authorities, financing authorities. We must strengthen regional and sub-regional governance mechanisms in health. Stronger coordination between key stakeholders is essential because in these challenging times, there is absolutely no room for competition among partners or even for duplication of efforts. It is together with well-coordinated collaboration that we can successfully overcome this pandemic and move forward to sustainable development. PAHO's actions are centered on building from past experiences and successes. During its more than 100 years of PAHO history, PAHO, acting with member states, have brought about many advances and achieved historical global successes. The region must now build on these for successfully confronting this pandemic and moving towards the goal of sustainable development. We need to support health systems transformation that is based on primary health care. And primary health care is not a new concept. The landmark conference in Alma Ata defined the strategy and set forth the imperatives and the actions that were necessary for achieving health and well-being for all based on the primary health care approach. Some countries in this region attended the 1978 Alma Ata conference. These basic tenets of primary health care continue to be valid today. And in PAHO, it is a cross-cutting value underpinning all of our programs and initiatives of PAHO. Just to note that primary health care goes beyond the first level of care. Primary health care is an approach. PAHO has championed primary health care in the Americas and in the world. You can see on this graphic, from 1978 in 2005, PAHO, under my leadership as assistant director, we championed the renewal of primary health care in the Americas. WHO, its World Health Report, has looked at primary health care now or never. And under the universal health coverage, we looked at financing the path to universal health coverage. This was led in WHO under my direction as Assistant Director for Health. And PAHO in 2014, we launched the landmark strategy for universal access to health and universal health coverage. And that was approved unanimously by member states in 2014. And this set the direction and the framework for PAHO's technical cooperation in recent years. That too was based on the primary healthcare approach. In 2019, the report of the High-Level Commission on Universal Health in the 21st Century that looked at 40 years of Alma Ata, which was chaired by President Bachelet of Chile and Ambassador Mendez from the OAS, provided recommendations to accelerate progress towards universal health based on primary health care. I launched the Compact 30-30-30, Primary Health Care for Universal Health, which was a call to action for accountability, that countries by 2030 would ensure that 30% of public expenditure would go towards primary health care, and that they would work to remove 30% of the barriers to accessing primary health care. The strategy for building resilient health systems and post-COVID-19 pandemic recovery to sustain and protect public health gains was unanimously approved by PAHO member states in September of 2021. The strategy defines 4 strategic lines of action. 1, transform health systems based on a primary healthcare approach to accelerate pandemic recovery, recuperate and sustain public health gains, and to retake the path towards universal health. 2, strengthen leadership, stewardship, and governance through a renewed focus on the essential public health functions. Strengthening the capacities of the health service delivery networks to expand access and to improve preparedness and response to public health emergencies. Increase and sustain public health financing in health and social protection, included for action to address the social, environmental, and economic determinants of health. In addition, member states, United States of America, Canada, and Colombia, and endorsed by all of our member states, requested the establishment of a technical working group to support the implementation of the strategy, to create synergies, to promote regional collaboration, and monitor implementation. PAHO will act as a secretariat and will provide expert support. The first meeting of this technical working group will take place on December 12, 2021, on the occasion of celebrating the Universal Health Day in the Americas. As we have seen with the advances in technology development, we've also noted that this region was not prepared to address its needs in terms of medicines, vaccines, and personal protective equipment. Supply chain disruptions, closure of borders, and the lack of base capacity in science and technology meant that the region was found wanting, and people died as a result. There were shortages of PPEs and diagnostics, medicines for critical care of COVID-19 patients, as well as vaccines. PAHO utilized its capacity through its emergency response capacity and its pool procurement mechanisms for strategic public health supplies, which we call the Strategic Fund, to supply over $350 million of critical medical supplies to our member states. The Strategic Fund and its big brother, the Vaccine Revolving Fund, are the largest multi-country pooled procurement mechanism in the world. And they have, since their creation in 1999 and 1978 respectively, contributed to control and elimination of diseases in the Americas. We have seen how these funds can support our member states in times of public health emergencies, and we will ensure that their capacity to leverage market dynamics accelerates deployment of medical supplies, including critical vaccines to member states. In September of this year, our member states approved a resolution to increase the manufacturing capacity in the Americas, requesting PAHO to support intersectoral coordination at the national level, to prioritize health interests, increasing the critical capacities of science and technology institutions and other key enabling functions, including regulatory capacity, and promoting collaboration in the development of regional capacities. At the request of Mexico, I launched the regional platform to advance the manufacturing of COVID-19 vaccines and other health technologies. The platform will foster research and incentivize development and manufacturing of essential and strategic health technologies in the Americas, expanding manufacturing capacities to ensure access to safe, effective, and quality products, facilitate information exchange, and foster cooperation between partners and countries, thus building solidarity in the region. The first initiative on the development through the platform is an absolute priority for this region. We have selected Argentina and Brazil to be the first countries in this platform. We called regional manufacturers, science and technology institutions to participate in an expression of interest to determine their interest in developing mRNA vaccines in the region. Frankly, I was astounded with the response. We received more than 30 formal expressions of interest from Latin America and the Caribbean, with 9 substantive proposals further developed. Earlier in September, during the second meeting of the regional platform, we announced the selection of 2 centers for technology transfer to produce mRNA vaccines. The selected 2 centers are Biomanguinhos Institute of Technology at the Oswaldo Cruz Foundation, Brazil. The institute has a long tradition in vaccine manufacturing and has made promising advances in the development of an innovative mRNA vaccine against COVID-19. Synergium Biotech, a private sector biopharmaceutical company, was selected as the center in Argentina. Synergium will partner with pharmaceutical Abscience, which belongs to the same group, to develop and manufacture active vaccine ingredients. The 2 companies have extensive experience in the production and development of vaccines and biotechnological medicines. The initiative was supported by PAHO WHO global partners, such as the Medicines Patent Pool, and we are continuing to work with them, WHO and global experts in product development. The call attracted some 30 expressions of interest from Latin American companies and scientific institutions. So we are now moving forward with similar calls of interest for adjuvants and other pharmaceutical grade reagents that are required for these technologies. And the platform will be moving to address other priority gaps in health technologies in the Americas in the future. We recognize the enormous growth in interest in vaccine production in the region, and we urge all countries and the private sector to continue in these endeavors. We as PAHO will continue to provide our technical support to these initiatives to ensure that we have the capacity to address our needs in the future. It is important that this country becomes self-sufficient, and it is important that we do so in a spirit of solidarity. Vaccine development in Latin America and the Caribbean declined during the 20th century as a result of lack of investments, inadequate development policies, and lack of regulatory capacity. In the last decade, the countries of the region have prioritized strengthening their regulatory system for medicines and other health technologies as a public health need, and important advances have been made. In 1998, PAHO created the Pan American Network for Drug Regulation Harmonization, or PAND, PANDH, as an initiative of member states and PAHO to support regulatory harmonization processes in the Americas. This was framed by the national and sub-regional health context and national policies and takes into consideration the existing asymmetries. In 2006, aligned with the objectives of PANDRA, the national regulatory authorities of some countries proposed a functional approach to strengthen regulatory capacity, including the development of a qualification system to be coordinated by PAHO. And quote, the objective of this system is to facilitate the establishment of mechanisms for cooperation among regulatory authorities in the region and progress towards possible interinstitutional recognition with the consequent optimization of human and financial resources. In 2010, PAHO member countries adopted a resolution which marked a milestone for the development of regulatory systems within the Americas, formally recognizing the importance of their role within the health systems. From 2010 to 2019, we witnessed regulatory systems improve their capacities to ensure regulatory oversight of quality, safety, and efficacy of medicines. And following the mandate of 2010 resolution, PAHO launches a pioneering program of assessment and strengthening of regulatory capacities using a standardized tool that allowed not only to support countries to improve their system, but also the assessments allowed us to identify 8 authorities that work at a higher level and that were designed as national regulatory authorities of regional reference. Together, these 8 reference authorities cover 82% of the population of the Americas, but represent only 23% of the authorities in this region. 10 years on, we issued the report, Regulatory Systems Strengthening in the Americas, Lessons Learned from NRE, a study that offers a look at the advances of those regulatory systems of the region through the experience of Latin America reference authorities. Regulatory science is a health science that ensures that the peoples of the Americas can have access to safe, quality, and efficacious products. It encompasses areas of clinical development, manufacturing processes and qualification, assessment of clinical trials, product authorization, and post-marketing surveillance, among others. Regulatory systems are those that leverage regulatory capacity for this purpose. Our member states, recognizing the critical importance of regulatory science in product development, the authorization and post-market surveillance, as well as regular systems development across the Americas, are based on principles of regulatory convergence. They have requested PAHO to develop a regional strategy on regulatory systems development for the Americas. We will present this strategy at our next governing bodies meeting next year. And so this important work continues, and we need to scale up. Through more than 40 years of the expanding program of immunization and the revolving fund, the Americas have achieved major milestones, and you can see them on the graphic, leading to, as we've said before, elimination of polio in 1994, elimination of transmission of measles, rubella, and congenital rubella syndrome in 2015, and the former in 2016, and the elimination of congenital tetanus. These are first in the world, global first in any region. All countries and territories have introduced COVID-19 vaccines now. Availability through bilateral agreements, COVAX mechanisms, local production in the case of some of our countries, and donations. 33 countries received vaccine doses through COVAX. Though we must say that COVAX has had some issues. More than 1.1 billion of administered doses, of which 52.9 million were distributed through COVAX. The number of persons in Latin America and the Caribbean who are now fully vaccinated is 39%. 26% of countries and territories in America have already immunized 40% of their vaccination target. You will recall that this is a target set by the Director General of WHO that by the year end, 40% of people will be covered by vaccines. Some member states with the highest number of fully vaccinated persons per 100 persons include Uruguay at 74.4%, Chile at 73.9%, Canada at 71.4%, and Panama 59%, and USA 56%. Beyond the rollout of the COVID-19 vaccination efforts, the overall strengthening and reinvigoration of immunization programs for vaccine protected diseases should be a cornerstone of the post-pandemic recovery process. We need to strengthen governance, leadership, and financing of immunization programs. We need to enhance monitoring of vaccine coverage and surveillance, incorporate digital intelligence strategies into routine analysis, strengthen the integration of immunization programs into the primary healthcare level towards universal health. We need to develop innovative and strategic communication approaches to build the social awareness and the trust in vaccines and to increase access to services. We need to strengthen human resources capacity for immunization programs and to use the scientific evidence to guide the decision-making and program implementation. You know, in conclusion, as we look to a future which is uncertain with regard to this pandemic, we know with certainty of the priority actions that must be implemented as we move forward. And so we invite everyone to read with attention the recommendations and guidance that this ECLAC-PAHO report provides, and we urge us all to consider the short-term actions, the implementation of public health measures and vaccination, as well as the longer-term investments that we must make in the peoples and systems of the Americas. PAHO is a specialized agency in public health in the Americas, and we are bringing to bear the wealth and depth of our expertise to tackle this epidemic, hand in hand with our member states and other agencies. And we will continue to lead health actions in this region, looking forward to ensure that we can quickly retake the path towards the achievement of the Sustainable Development Goals in 2030. Thank you. The road ahead is a long one, but we must continue in solidarity. Thank you.
Muchas gracias, doctora Carissa.
Thank you very much, Dr. Carissa Etienne, Director of PAHO. We will now give the floor to the presentation from Alicia Bárcena, Executive Secretary from ECLAC. Go ahead, Miss Bárcena. Thank you very much, Maria Amparo. And since as we usually do it in our agencies, we will speak in Spanish now. I would like to firstly thank Dr. Carissa Etienne for a very broad presentation that was very interesting, that combines the joint document that we have created with actions that PAHO is working on, which provides it a very important wealth to this event. So if I may, firstly, I would like to highlight the cooperation that we've had with PAHO, and I believe that it's been very important to be able to really foster our common capacities. And I will talk a bit to you. I hope you can see my presentation. Let me know if you can see my presentation, please. And Maria Amparo. Yes, we can see it. Great. So our document is called Prolonged Health Crisis and its Impact on Health Economy and Social Development. This was presented jointly by Carissa Etienne and myself. I'd like to thank all our work teams, Roberto Arenas and James Fitzgerald, who have been the two counterparts to be able to achieve this joint proposal. And what we have been saying, this is actually the second policy briefing that we have jointly, and we have clearly stated that without health, there is no economy. We said that in the first policy brief. And now I want to highlight is that without health, we will have no sustainable economic recovery, because this, why has this health crisis has extended itself is because the social crisis persists. And it's imperative and urgent that we accelerate the vaccination processes, and we need to overcome the initial gaps, because we've had them. And at the international and the regional level, we have to overcome that. And therefore, it's imperative to accelerate integrating focuses in such a way that we can understand health not necessarily separately from the economy or social protection or finances. This is what we believe is crucial, and that's why ECLAC's contribution, I believe, can be crucial. We need to take advantage of this window of opportunity to restructure our health systems and to advance to universal systems that are solidarious and resilient. And here, obviously, PAHO has a great experience, but we need to be very firm that we need to restructure our health systems. So the role of the state, and I believe this is something that we need to emphasize, and the state already has the challenge of looking for vaccines and to be able to deploy these to vulnerable populations, and also to accelerate the economic investments in the health systems and to ensure financial sustainability of the social protection systems. And of course, this includes health. So I think ECLAC and PAHO, we are joining our efforts to support the vaccination plans in the region, to search for a broader vaccine access and ensuring that they reach all, because we have many inequalities in our region, and to be able to advance in creating our own capacities to produce vaccines and medication. So with this, ECLAC has a broad experience, everything that is related to the production and manufacturing and the industrial development, because that's what we're talking about, to develop our own capacities for development of vaccines and medication. This is part of an industrial policy. So at the regional level, we see that the pharmaceutical sector, well, this we want to do at the regional level. And of course, the pharmaceutical sector is key for this development. And we have seen this in the developed countries. The impacts of this prolonged crisis in the economy and the key dimensions of social development, you will find it in this document, especially in chapters 1 and 2, which I will analyze here today. So firstly, our region was one of the most severely affected of the developed world, of the developing world. We have cases confirmed of 45.7 million people, deaths of 1.3 million people, and we have also all these numbers that we see here. We have cases of 45.7 million and deaths of 1.3 million, as Carissa has already mentioned. So these effects that we see here in this chart in our health, they have been in some way, we have tried to find the reasons why these situations have happened. And one of them is that undoubtedly in our region, we have an urbanization of 80%. And the truth is that the mortality has been a bit higher in the municipalities where we have a higher level of poverty and less access of public services. And a third of the poorer homes in our region, they live in these situations with 3 or more people living in one room. So we see here that the extreme poor are in this condition where they have almost 55.4, 55.1 that are in this condition. And therefore, the link between health and social protection and the provision of public goods is central, especially because the most vulnerable population is the one that has a greater index of comorbidities. That's why we have to count with more integrated policies for economy, social protection, and also we need to articulate our primary health sectors, like Dr. Carissa said. And I think this is crucial because primary health is something that we need to advance to a universal coverage, and also our social protection systems. Many people that did not have coverage, that didn't have health insurance, that didn't have pensions, on access to these social services and health services. So also in terms of the economy, this has been the region that has been affected the most. In 2020, we can see that the GDP fell 6.8, but this is the region that has been most affected in the world. We see that we've had a sharper decrease, even more than Sub-Saharan Africa that fell 1.8, or the advanced economies that fell 4.6. So we had a decrease of 6.8. Also in job loss, we lost 9% of our jobs in 2020. We were the region that was most affected in terms of job loss. And basically looking, we see a great step backwards, especially regarding women in the workplace. We can see that in between 2019 and 2020, the variation was very important, and this significantly increased the rate of women. So a lot of women lost their jobs, and they were not able to return to the labor market, specifically because of the huge load of work they had in their homes. So therefore, this rate of unemployment is greater in women, and also their participation also decreases. And here we see 9%, and how we have a reduction here, the rate of participation. So we had a decrease, people stopped looking for jobs, and also we have also the unemployment rate. So the social crisis. So this was something huge, and we had and we see high levels of extreme poverty and inequality. And so the social crisis, although we're going through a recovery this year, which is true, we are seeing a recovery, and we are expecting high growth rates of 5.9 in our region. We have not been able to recover 6.8% yet, but also we haven't recovered the jobs in their totality, and we still have these very high levels of poverty. So here we see the people that are in these poverty situations. They reach 78 million people, 8 million more than in 2019. And the people in a situation of poverty, they reach 209 million. So we're talking about 22 million more than the previous year. And inequity is also increasing. So the Gini index increased in 2.9%. So it's crucial to keep these that the countries and the governments can keep these emergency transfers going and the social protection measures. So we have here two scenarios. One, if we don't have the wealth transfers, which is the yellow line, the poverty would increase even more in 2021, and extreme poverty as well. So our proposal is that at least we can continue with 50% of these transfers. That would imply an increase of extreme poverty and a maintenance of poverty as a whole. So of course, these are not encouraging numbers, but we think that at least the governments can support to mitigate the growth of poverty. So the crisis has been tremendous in terms of education. So here we have called this a silent crisis. Yesterday, we presented with UNESCO and UNICEF the risk that the region has of a lost generation. And this has to be addressed urgently, because here we see with a lot of clarity that we lost almost a whole academic year, and practically in all the countries, these orange bars shows that the schools that were partially closed in a large number of months, and the ones that were totally closed in the number of months. So this has really, so it's been a long period of school closure, and we have an average here that is greater than an academic year, 40 weeks. 167 million students lost up to 1 year of scholarity and in-person schooling, with a huge impact in their learning process. And this really has a strong effect or impact due to the digital gap. In Latin America and the Caribbean, we have 60 million homes that are not connected to the internet properly. So, of course, online education and online health has not been possible to be able to carry it out during the pandemic. So the closure of schools also, this has an impact that has gone beyond learning. So you can see here in this chart where we present here how 3.1 million children and young people are in risk of leaving school altogether. And we have here, we basically break this down. We have the tertiary school, middle school, and the two segments that we see in the greatest risk is in tertiary education. So we can see that we can see a school abandonment that is quite high in this level of education. And of course, those are most affected is the pre-primary schooling, with the difficulty of connecting small children to online learning. And this has had a strong impact on education and nutrition and mental health. This has exposed these groups and the young people and the children to different types of violence. So child poverty in 2020 has affected 51.3% of the population, which means 91 million boys and girls and teenagers. So poverty in our region has a face, and these faces are our children. And the schools also are an institutional path to help to care and to feed and to take care of our children's health, which now the women are having to take up that burden. So the region has faced these problems, that the pandemic finds our health sector fragmented, and we see that we have chronic subfinancing. As Dr. Carissa mentioned, she talked about underfinancing regarding the GDP per capita. And here I'm talking about the private and public expenditure in health. And we see here that there are only two countries that go over 6% of their GDP in health expenditures, and it's only Cuba and Uruguay. And we see that the rest of the countries, and we see Haiti, for example, they have a higher proportion of private spending instead of public spending. And we see that this is very severe. In our region, we see that the average of public spending is 3.8% when WHO recommends 6. Only two countries achieve that 6%, Cuba and Uruguay. The rest of the countries do not get to that level. And there are some countries that get close, like Argentina, Costa Rica, but we still see that we're not at that level. And the OECD countries are close to 7% of the GDP. So the sub-financing is reflected in the low capacity of our health system. In this chart, we can see here the quadrant to the top right, which is the virtuous quadrant. And here we can see that we have, especially the countries from the OECD. What we're measuring here is how many doctors per 10,000 inhabitants, how many hospital beds per 1,000 inhabitants. So here we have the OECD countries. We see that the UK and Spain are underneath regarding hospital beds, but in medical terms, they are at the recommended levels, which is 20 doctors for every 10,000 inhabitants. But here we see Brazil, and we see some of our countries here that are in the lower quadrants, which with Latin America and the Caribbean, which is a quadrant that shows us that we don't have enough beds and we don't have enough doctors. So therefore, we have a lot to do. So the high out-of-pocket spending, this is tremendous. And what we're comparing here is that as we have more public spending, obviously public spending in health, so we have a greater access to universal public health. We have a smaller out-of-pocket spending. But here we see that in our region, the out-of-pocket spending is 33.6% of the total spending in health. So the families are spending a lot on their health, and therefore, and this is the main component, certainly, regarding private spending as well. And we see here that OECD has 21%, so they have greater coverage and more access, and in our countries, we don't. Obviously, we have cases like Cuba, Colombia, and Uruguay that do have, they have out-of-pocket spending, which is less than the rest of the region. But this is an important topic. We can see here Guatemala, Grenada, Honduras, Barbados. So we can see a high rate of out-of-pocket spending. And another one of the weaknesses that we've seen during the pandemic is the high dependency, regional dependency on imports for pharmaceutical products, and which have been important to the pandemic. Our region produces generic medications, but not necessarily for what the pandemic required, both in pharmaceutical products and also in active ingredients. So the region has a negative balance here regarding imports. So here we see we have a deficit here in the pharmaceutical sector that comes and it means a limited supply of medications and vaccines. And we have the dependency with abroad that has been growing and has manifested itself in a higher trade deficit. As we can see here, our region is exporting, but imports much more. So our balance is clearly negative. So we've had also, we can see that some of the developed country have basically kept a great amount of vaccines. And they've been hoarding vaccines, and this is something that has affected the region and how we affect and how we face this in a fragmented manner. So we have been talking about how we can join efforts so that our countries can develop joint strategies. But here we can see the tremendous reality of this global asymmetry. So we can see that the European Union has 20% of the total vaccine purchases, and they have only 5.7% of the population. The US 10.3 with 4.2 of the population. So we see that the developed countries have really been hoarding these doses, these high income countries that with 13% of the population, they have affected 30% and they have bought 30% of the vaccine. So this has affected the doses that have been delivered to our region. And this has been responding to these bilateral agreements that have we see represented here in this fragmentation. So this leads us to where we are today. The region will not reach 70% of the total population vaccinated. We saw the chart that Carissa showed us, and we can see that there are very few countries that are above the 70% line of their full, with both doses, of course, of the vaccine in these countries. And we were not going to be able to achieve this in our whole region. And we can see that most of the countries do not go over 40% of their total population with the complete vaccination scheme. And we have the vaccination has increased in the last few weeks, and we hope that we can maintain this speed in the last quarter of 2021. But even so, the scenario that we see is that 11 countries could have the availability of vaccinating 70% of the population with both doses this year, and by mid-2020. Only 7 countries will be able to do it by the end of 2022, but 15 countries, and this is where we have to focus on, would only be able to achieve this in 2023. And that's why we have to act quickly and accelerate this action. So what recommendations of policies to control this health crisis and advance to a transforming recovery with equality? What do we have within our joint report? So firstly, we can see this chart that it highlights the fact that the role of the state has been crucial. So the yellow line shows the index of health measures that the states have undertaken. So we're talking about 28 countries of Latin America and the Caribbean. So these measures have been very important, but they're basically measures of social distancing and lockdown. And so these measures were taken when the cases in the blue line, these daily cases started to increase in an exponential manner. And therefore, the measures became more and more restrictive. And this logically had a great repercussion in economic activity. So what is interesting here is that the combination, when the vaccination begins, when we begin to advance with vaccination and we're able to get to 20% of the population vaccinated, so more or less in September, approximately, as an average in the region, 20%. So there's where we can see this combined effect of the state measures, and we see a sharp decrease of the number of daily cases. So here we can see clearly that this is so relevant, the role of the state, because the role of the state is regulatory on one hand, but on the other hand, and in this specific case, to be able to count on vaccines, to be able to advance in the vaccination of the whole population. And of course, at the regional level, this has really taught us a hard lesson about the importance of advancing and vaccination and vaccines production and other health technologies. We cannot keep lagging behind, and this is something urgent. And then also we have the centrality of the state, which is crucial to be able to reach a greater investment and to restructure the health systems with a clear focus on primary care. So, and so I think here in PAHO, we have a common cause that we need to accelerate public spending for health. And we need to advance in public spending, and we need to reach this goal of 6% of the GDP, and we need to reduce with that the out-of-pocket spending. And on the other hand, to give priority to the primary care systems, because that's where we will be able to reach prevention and care for these communities, and this with financial sustainability. So here we comparing the public spending in health. We have here 3.8 in the green line, and from 2.8 to 3.8. And of course, as we increase public spending, we reduce out-of-pocket spending. And here we want this decoupling between the public spending and out-of-pocket spending. Obviously, these are different series. We're comparing public spending at the right and public and with the left, sorry, and the private spending with the right series. But we want this detachment to happen. And also, how can we achieve, how can the state maintain these social protection measures that are emergent? On the other hand, we need to have expansive tax policies, fiscal policies that will increase public investment in several sectors, and of course in the health sector as well. But we can see that our situation in the region is quite dramatic, because our region invests this red line, 17.6%. That is the investment regarding the GDP that our region is investing. So we are the region that invests the least in the whole world. If we look at the developed economies, they invest 22%, and they don't need that much anymore. So we have on average in the world 26.3, and the emerging economies 32.9. So we need to increase at least 9% to be able to get to the global average. And this means expansive tax policies to be able to maintain the urgent social protection and investment, as we see that has been at the minimum level of the last 3 decades. So we're talking about since 1990, we have not been able to overcome or to surpass this terrible decrease. And then the small importance that we have given to this public investment. So we need to keep these transfers, cash transfers, and improve and also support the productive sector. So we need to support the homes, but also the productive sectors, and especially the small and medium-sized companies, because also the labor market, the job market that has been affected mostly has been the informal. So in much of this, these jobs are created by these small and medium-sized companies. So we need to be able to work on the tax laws, and we need to fight tax evasion. We have repeated this before, and also we have to improve the we have to reduce and revise any tax benefits for major companies. And also we need these tax expenses are a large amount of the GDP. So there's room for improvement there. And also we need a progressive collection that will strengthen and extend the reach of the income tax, especially in the countries that have a low rate and property and wealth. And this is very important. And also we have recommended the way that we can reach international standards in terms of royalties, mining royalties, and hydrocarbonate royalties, so that the whole region won't go to a race to the bottom, but that we can go to the best international standards. And the same thing in digital economy and also services and goods that cause environmental damage to public health. So in CEPAL, we see that sustainability is important as well. So we need a little more investment and spending. We also need to improve our collection of taxes. So this requires a restructuring of our health systems, and we need to strengthen our welfare. We need to ensure universal coverage, gratuity, and quality on these primary care services. We need to prioritize redistribution policies, and that we have to be solidarious, focus on rights. We have to leave no one behind, like the 2030 agenda says. We have to build a social protection system that is universal and comprehensive, and we have to be sustainable, and the society has to be a society of care. Not only women need to provide care, and we also have to strengthen the institutions and the private and public partnerships. So we have a great amount of institutions that have regulatory responsibilities as well. So basically these private and public partnerships that are focusing on industrial policies that are sustainably technological, so we can help to improve the health sector. So you want to promote producing vaccines, value chain, medications, and of course, this is going to require a social agreement focused on rights and equality, and also related to a tax agreement that will ensure financial sustainability of our health systems. We can't just do that now and stop doing it a year or 2 years later, and we need to really build a welfare state. So what opportunities do we see for regional cooperation? This seems very important in the framework of this joint effort that we're doing with CEPAL and PAHO. So the regional cooperation major imperative. So the pandemic showed us that to act unilaterally and the supply of vaccination and medication didn't work in a globalized world. And we can't create immunity islands, leaving some countries outside of the total vaccination scenario. And also this chronic subfinancing of research and the weakness of our industrial policies that didn't allow us to develop vaccines in a timely manner and to build a market in a regional scale. So if we're talking about industrializing and improving our production levels, we're talking about scale. We can't ask a small country to produce vaccines. This has to be an exercise for regional integration that will ensure more productive autonomy, universal access for vaccines. And also we need to create a value chain. Some countries produce very important medical products, and that we need to be able to generate or create these value chains at the regional and sub-regional level. And at the level of our region, we need to close these asymmetries, because within our region we have serious asymmetries, and for that, so this can really, we need to strengthen and improve this deficit that we see in the international level. So in the short term, it's urgent to cooperate to ensure the access to vaccines, to advance in the vaccination of the whole population. So therefore, we need to increase vaccine purchasing. We need to, we already talked about the mechanisms that are available, like the revolving fund and COVAX. We need to also get donations that have an excess of vaccines to be able to face this deficit. Mexico has donated a lot of vaccines. So we see the US also donated a lot of vaccine, but we have to increase the speed of these vaccines. So we need to also strengthen the inoculation and immunization in these countries and strengthen the primary care systems with health-based. And also we need to strengthen our public policies to have a greater acceptance and follow-up of the vaccinated population, obviously with sensitivity to the differences in the cultures that are relevant. So we need greater regional coordination to have health self-sufficiency and face future crises. So the pandemic is opening up a window of opportunity to improve our production of vaccines and reduce our external dependency, but we need a cooperation of public stakeholders, businessmen, and the academia to develop a regional pharmaceutical industry, to have a regional market in a large scale and promote regional value chains. So of course, this requires more integration and regional coordination, and this is the call that we do to the countries, greater integration with a pragmatic vision where we can advance in the harmonization and the regulatory recognition, and to be able to have a network of clinical testing, and we can have a network for development and research that will deal with these health issues. So I think ECLAC and PAHO want to make available our capacities and instruments and platforms, intergovernmental platforms, to be able to strengthen the capacities, productive and technological capacities, to facilitate a better articulation between the public sectors and the academic and business sectors. So for that, we have collaborated with ECLAC in this self-sufficiency, health self-sufficiency plan for Latin America and the Caribbean. And of course, as this was already presented by Carissa Etienne, they count with a regional platform for the advance of the production of vaccines and other health technologies, and they have presented their map to be able to reach this goal. So I just wanted to tell you that this health self-sufficiency plan was requested by the pro tempore presidency from CELAC in Mexico to advance and to prepare ourselves for future emergencies. For this and future emergencies, so we can ensure in the short term access to vaccination, they asked us to do a stock of capacities, technological and industrial capacities in the health sector. And therefore, we have created several actions to be able to reach this inventory of capacity, so we can present this on the 18th of September of 2021. These are basically proposals that have two different views. In the short term, to accelerate vaccination processes, to have more access, and of course, we have immunization, and PAHO has a very important role, but the countries also want to take their own action to be able to generate possibilities of joint purchases and so on. And of course, in the midterm, how we can strengthen our technological capacities. Of course, the first step is to ensure large-scale market and strengthen research and facilitate our production. So we have presented these action lines. We have this. So we have here we have one network of lab testing and also purchasing mechanisms. But to be able to really advance in the production of vaccines, we need to create consortiums. We need public-private consortiums, and we need to analyze the flexibilities regarding the intellectual property, and to see what else do we need. And of course, we need a regional market that we can measure. So we have done an evaluation that has been very comprehensive about the pharmaceutical industry in our region. And we see that these are the leaders in the technological chain in the global level, but in our region, they only represent 8%. So in the world, 51%. And in our region, we have these national countries that concentrate the market of medications, advanced drugs, cutting edge and the national capital companies that work in generics and biosimilars, and we need to move to a transparency in certain pharmaceutical markets. So this is a very important industry because it contributes strongly to the growth of the economy, productivity, wages that are much higher, and the composition of gender is very interesting. And we have analyzed this because to develop this industry is not only good to have availability of drugs and equipment, but it's good for the economy and equality. So we have delivered this plan, and ECLAC adopted this with, so we have three actions. We have the coordination between regulating agencies, the national level. Then we have a mechanism of purchase to access universal access. So we have here the revolving fund and COVAX, and third, a platform for clinical testing. And then the midterm, we want to analyze the consortiums, work with industrial chambers, and to see how we can try to generate, to try to strengthen the consortiums that have already been working. As Carissa said, Argentina and Brazil are one of the first ones, and ECLAC has designated a commissioner from each country to define the next steps and financial modalities. So in terms of convergence and acknowledgement, we have had a dialogue with the sixth agency, the regulating agency, the level 4. And here we have PAHO that participated. And we believe that these regulating agencies, level 6 level agencies, can be the base to be able to advance in this Pan-American network for the harmonization of the pharmaceutical regulation, so we can advance in a subregional level, and also the platform for clinical testing. And I highlight this because in our region, because we have here in 614 clinical tests and 230 studies. So this also always done individual level. So what we're proposing now is that we do a regional platform for clinical tests that will allow us to have a greater negotiation power, because without a level 3 clinical test, we have no vaccine. And finally, the creation of consortium. So I think this is very important because to develop vaccines, we will need certainly we need to have a deployment of human resources, financial resources, and we need to increase our participation in the region. So we need to see what are the consortiums that we already have in the region to be able to advance to a greater production. So here we have the agreements that we already have, which is what we can have a starting point to be for the co-production of vaccines that have been developed in developed countries, but also vaccines that have been developed in our region, like in the case of Cuba. And so also in CEPAL, and we can see that we have some deficiencies regarding our intellectual property, but also what we need, right? And we have we did a detailed assessment of the patents and what we require. And certainly we need to articulate a national purchasing system, and I think this is possible. And this is what PAHO and ECLAC, what we can do jointly with the subregional mechanisms for integration, with banks, with the private sector, with the academic sectors. This is urgent, but what we need is to boost the capacities of the region to be able to finally reach universal access. That's what it's all about, to support primary care and health, which is what people receive, and we need to promote the strengthening of the whole compound of the health in the region. Thank you very much for your attention, dear Carissa, dear colleagues from PAHO. It's an honor to participate with you. It's an honor to collaborate together, because I think this makes us stronger. Thank you very much, Maria Amparo. Alicia Bárcena, Executive Secretary from ECLAC. Thank you very much for this presentation. It's a broad presentation like the one from Dr. Carissa Etienne, the Director for PAHO. It's a privilege to have these presentations from our distinguished panelists. And now we're going to start the Q&A. We have several questions from the journalists that are here with us today. So we're going to start with a question for Dr. Etienne, and then another question for Ms. Bárcena to begin. So Dr. Etienne, the question for you is from Gisela Salomon from the Associated Press service. Can we leave the pandemic without economic resources? So who must agree upon them? How do we obtain this? How much does the region need to control the pandemic? And how can we leave this economic problem if we don't control the pandemic? Go ahead, Dr. Etienne.
So thank you, Gisela, for this really very important question. And as we've said, today countries need to accelerate vaccination and to maintain their public health and social measures if they are to control the spread of the virus and minimize its impact on the health of their population. And this is a crucial step. What is clear is that financial resources are needed now and will also be needed in the future to overcome the pandemic. You saw some of the slides that ECLAC presented through Alicia. The health, economic, and social consequences of the prolonged crisis are enormous, and they call for increased investments, not only in health, but in several areas. With regards to vaccination, it's not just merely the cost of the vaccines. We must also factor the cost of the doses actually reaching people's arms. So it needs supplies. We need to be able to have healthcare workers. And this cost varies greatly. And the data from national vaccination plans of our region shows that it averages somewhere about $2 per dose. And that excludes ultra cold chain requirements and the additional human resources that would be required. We estimate that the cost of COVID-19 vaccination plans for the countries of the region, and that is where we have data, averages about 7.5% of the total public expenditure in health. From the 2018 data, we see a context of countries that are already facing severe financial resource limitations, with an average public expenditure in health of 4% of their GDP. That's well below 6% of the GDP that has been highlighted both by Alicia and myself. That was agreed in 2014 in the PAHO regional strategy for universal access to health and universal health coverage. Most of these investments related to the health sector will necessarily have to come from the public sources. That is government spending. And that case was well articulated by Alicia. And it is especially challenging given the circumstances of low economic growth and the decreasing public revenues. Most countries have already made substantial efforts to reinforce expenditures in health within their public budgets and to increase the allocation of resources for vaccinations. They have also worked to increase health services capacities to manage the cases of COVID-19. But these remarkable efforts will need to be heightened and sustained over a longer period than they initially expected. And so many governments will have to resort to international cooperation to help deal with some of these expenditures. It is lucky that partners like the World Bank and the Inter-American Development Bank have offered soft lines of credits or even concessional grants to assist governments in this fight. But it requires a sustained political commitment to ensure that sufficient resources are placed from the public purse to health. As the region most affected by the pandemic, we will not overcome the economic stagnation that was produced by the pandemic without controlling the health impacts of the pandemic. This has been repeated. And this was mentioned in our collaborative document with ECLAC last year, and it is now reaffirmed in the one we are presenting now. We need our governments to accept that health is not merely a social sector, that health is a contributor to economic and sustainable development. Thank you.
Muchas gracias.
Thank you very much, Dr. Etienne. We have the following question for Ms. Alicia Bárcena that comes also from Gisela Salomon from the Associated Press. And the question is, during the pandemic, the countries have debts at unprecedented levels, and they have scarce economic resources. So the economists, they say that we need structural reforms to be able to boost growth, and the doctors say we need to invest more in the health system to be able to control the virus. So what is the priority in Latin America and the Caribbean? Go ahead, Ms. Bárcena. Thank you very much. And complementing what Dr. Etienne said, the countries effectively had to spend more in a context of less income. And this demand has been done through the debt. So in 2020, there was a record in terms of public spending that increased from 21.4% to 24.7%. So we're talking about 3.2, almost 3.3 2 points more between 2019 and 2020. And the countries did this to finance subsidies and transfers to face the crisis, and also to basically deal with the health regarding the primary care, which affects all these cases. So therefore, the region has a greater debt in the region. So the public debt reached 53.6% of the GDP, so an increase of 10 points regarding 2019. So this is also because the denominator, which is the GDP, also fell. So not everything was debt. But what we have to say is that there has been a deterioration of the public accounts, and in the Caribbean, this has been quite severe because we've seen an increase in the primary deficit and the public debt. Another thing that certainly makes things complicated is the cost of the debt, the payment of interests, because the payment of interest has increased, and practically now it's about 2.7% of the GDP. So almost similar to what many countries spend in health. So in this context, we in ECLAC, we have been boosting expansive tax policies, and we're concerned because an increase in the interest rates in an early manner and a tax adjustment early on can discourage investment, and it can also discourage this important mitigation of the pandemic effects. So if we think that it's very important to keep these social transfers, support the productive systems, and also we need to boost jobs. So, and here I want to focus on the health sector because we don't see that there is a trade-off between the health sector and the economy. We have already said several times that there is no duality between investing in health and economic growth. So investment is crucial for the growth, the economic growth. So we had to go to a lockdown because of a health issue. So this is something that we need to avoid. So to contain the pandemic, we need to accelerate access to the health systems, and this will boost growth. So we should go from 3.8 to 6%, and that is crucial. And not only is this expense, we're talking also about investment, because there we can invest in infrastructure, technology, we can invest in production, vaccines and medication, and this also generates employment. So this also boosts the economy, and that is what we believe. Here we need to clarify that the health sector is work intensive. So the development of strategic sectors associated to the health sector, like the case of the pharmaceutical sector, we've seen that it has very positive effects in the productivity, in jobs, and in women. So I just wanted to repeat our mantra, which is that without health, there is no economy or sustainable recovery. Thank you very much, Mrs. Bárcena. So horas del tiempo, and we have some questions, and I would like to. So now I will have one more question, or actually two last questions, one for Dr. Etienne and one for Ms. Bárcena before we close this conference, this press conference, if that's okay with all of you. So let's go with a question for Dr. Etienne. So this question says the following. It's from Anthony Bolden from the Reuters agency. And he asks, what will be the impact of the COVID pandemic in Latin America and the Caribbean in 2022? Go ahead, Dr. Etienne. Company and also the economy of care. So so we need to promote this sector as economic sector, because we think that women can be a great engine for recovery. And finally, to give it a number, the countries in Latin America and the Caribbean, they adopted more than 450 social protection measures for the population. And so the most of these measures are focused on monetary transfers and also goods and services. But there are some that are very relevant. And then we have something regarding the rent prices. So we think, so these measures needs to be extended in 2021, especially in the countries that have not been able to reach total vaccination, and they need to have this income for emergency funds. So that's when we need to emphasize.
And others, I do believe that the region, there's also, we see what we should be doing in the case, for example, the pension system, when also we see that there's a crisis in the, let's say, also that there are more affiliates in elderly population, and not necessarily this means that there were higher contributions made by the younger population. So it's a legacy also here that we have to address. And I would add, our countries have acted firmly, but now their country is also going to be more efficacious than others. Yes, Emiliano Vanella, also our journalist. Yes, we have this information. I can provide it to you. Arenas also can give you details. We have compared data country by country, or what measures have been adopted in each one of the countries in the region, provided with information later. Yes. Fantastic. So thank you very much, Mrs. Bárcena. This is how we get to the end of the Q&A session with the different journalists that have been with us today. And also the communication team of PAHO and ECLAC will be also able to respond to the other questions. They have been the presentation as a joint publication by both organizations, prolonged health crisis and impact on health, economy, and social development. And in closing, we are now going to close with a final message from Mrs. Bárcena and also for Dr. Etienne. Mrs. Bárcena, you have actually you have the floor for your final remarks. I would like to stress a few things. In the first place, I would like to thank the possibility of collaborating with PAHO. PAHO is the organization is a principal mandate in the Americas, so as to address issues of health, the complex of health as in its ensemble. I would like to say in the case of ECLAC, we address the different aspects also from the perspective of actual development of the economy and also tax issues. I believe that we are facing a very important moment. We should unite our efforts at platforms, our capacities, and also we like to tell the different countries of the region how important it is for us to have a greater integration, better regional cooperation. At the end of the day, what we do it according to the mandate provided to us by the countries. This is the key for advancements, and I believe there's this strategy, joint strategy to be developed. A United Nations system that we are, anti-American systems. Definitely. Thank you so very much. Thank you for this opportunity. And we hope that from here on, we have a greater self-sufficiency in Latin America, in the Caribbean, and in the whole region. Thank you. Thank you so very much. Thank you. To benefit the people. That's the actual final goal. That's it. Mrs. Bárcena, thank you very much. Dr. Carissa Etienne, please, you have the floor, madam.
Let me begin by thanking the media personnel who are continuing to be with us. Let me also thank Alicia and her staff for the opportunity to collaborate at a very special time and to look at the nexus between the social, economic, and health. Let me reiterate the fact that even well prior to the pandemic, this region suffered and actually provided the stage for the acceleration of the pandemic in the Americas. Really, primarily the inequity that this region has suffered for so far too long, and the fact that we have inequity in the region, inequity around the global environment, and inequity at the national level. And this has driven this pandemic. I look forward to the day when our countries, our governments will accept the responsibility for the health and well-being of their peoples, that we would target those that need to be targeted for more equitable and social development. Because we cannot achieve real development if we do not ensure that everyone is carried along, with an emphasis placed on those who are poor and disadvantaged. It cannot be business as usual. And to arrive at that stage, we will need to look really in terms of how public financing is used. We will need to ensure that we join hands, not with the private sector, civil society, and all the other actors. I look forward to the day when we will have solidarity, where this region and the countries of this region will all come together and recognize that the health of the region is predicated on the health of every country and every individual in this country. So this is the second time that we are writing about this nexus with the economy, health, and the social sector. And this predicates not only how are we going to respond to this pandemic, but more importantly, how are we going to ensure sustained development in all of our countries. We need everyone on board. It is everybody's business. We need the private sector, we need governments, we need institutions, we need agencies, communities, because we often leave out those communities. We need everyone on board so that we can have a holistic response to COVID-19, that we can ensure development that prevents us from doing so badly at the next pandemic. We need to be prepared. And so I want to thank all of the agencies and countries that are moving towards greater solidarity, because I am convinced that it is only in solidarity that this region will be able to successfully confront COVID-19, but more importantly, to successfully ensure development for all of its peoples. So thank you again, Alicia, and thank you to the media for joining us this morning.
Con este poderoso llamado a la
With
solidaridad,
powerful call to our solidarity, we close the presentation to thank you all and the journalists, the all materials, including the presentations by Dr. Etienne, by Dr. Bárcena, will be available in our web pages of each one of our institutions. Thank you so very much, and good afternoon to all of you. Goodbye.
Recording stopped.